Rat Bite Fever in Thrush by Selena Tharp, Ethan Lipley, and Swabeda. Pathogen description. Is the infection viral, bacterial, fungal, protozoan, or helminthenic? The infection, Streptobacillary rat bite fever, is classified as a bacterial infection. The infection, thrush, is classified as a fungal infection. Give the causative agent of each disease. Provide the scientific name. Streptobacillary rat bite fever is an infection disease. It's caused by two different bacteria. Streptobacillus monoilemformis, which causes RBF, Streptobacillary rat bite fever in North America. Spirillum minus, which causes RBF in Asia. Oral thrush is caused by an abundance of growth of Candida albicans on the lining of the mouth. Describe the morphology of each causative agent. Use appropriate terminology and be specific. The causative agent of Streptobacillary rat bite fever consists of Streptobacillus monoilemformis and Spirillum minus. Spirillum minus is a gram-negative coiled rod bacteria. The causative agent for thrush consists of Candida albicans being overgrown in the lining of the mouth. Candida is a yeast that are singly oval-shaped budding cells. Describe how each causative agent might be spread. Streptobacillary rat bite fever is spread through bites or scratches from rodents carrying the bacteria. The bacteria itself can enter the body through a bite or through mucous membranes. The bacteria can also be contracted through saliva. Oral thrush is not spread through person to person, but it can be spread if a person were to come in contact with the person who has this infection saliva, such as kissing a person who has thrush.
Signs and symptoms of rat bite fever are vomiting, headaches, muscle pain, joint pain, or swelling. Rashes that are usually around the leg and the feet, as is shown on the picture right here. If it is left untreated, it can cause severe disease and death, or infection lying the heart, covering over the spinal cords and brains or the lungs. Signs of thrush are loss of taste, cotton feeling in your mouth, that creamy white lesions are your tongue, inner cheeks, sometimes on the roof of your mouth, gums, and tonsils, as it shows right here on the picture. Burning or soreness that may be severe enough to cause difficulty eating or swallowing, cracking and redness on the corners of your mouth, or irritation and pain on your dentures. If this is left untreated, it will persist and it will make your mouth feel more uncomfortable. If there's a risk that if the infection spreads further into the body, it could cause life-threatening blood poisoning. Treatments that are available for rat bite fever are: when you scratch it, you should first wash it out with your wound with clean water or soap, or clean it out with hydrogen peroxide. Then you should apply some skin ointment to cover up with a band-aid. A healthcare provider should provide you with some antibiotics that may take up to 2 weeks. Prevention that we can take so we don't get rat bite fever is to stay away from rodents, avoid areas where they poop and pee, use dissectants such as sanitizers and anything to clean around that area where the rodent pooped and peed. Seal holes around the house so that they can't enter. Avoid leaving food out because easy access to food draws them in. Wear gloves, goggles, and masks when cleaning up after them. Prevention for thrush is to practice good oral hygiene, meaning brushing out our teeth and flossing. Avoid mouthwash or spray. Seeing the dentist on a regular basis. Limit the amount of sugar and yeast we take in. Avoid smoking and tobacco uses. Treatments that are available are doctors will provide you with antifungals, which will help treat thrush, which is available in tablets or liquid forms. This usually takes up to 10 to 14 days. There are home remedies that you can use, such as switching your mouth with warm salt water, taking probiotics, or eating yogurt that contains healthy bacteria.
Common is rat bite fever. In common times, Staphylobrachial RBF is a very rare illness to have. There is only a 10% chance that the victim can contract RBF, exchanged through rat bites. She must be bitten by an infected rat, which is only prevalent in rat-infested areas. There's roughly 2 to 4,000 cases of RBF each year in the US. Where is rat bite fever most common? The people with the highest risk are those who work with laboratory rats, which, while having a lower chance to infect people, due to access and closeness of the rats on a daily basis, it is still a danger. The country that has the most cases of RBF is North America, due to the high amounts of rats and how close they are to the public. A case study of RBF is when a 61-year-old Japanese man entered a hospital after feeling fatigued and experiencing fever and headache. 6 days before admission, he had skin eruptions on his soles, palms, and knees. On the third day of the hospital, he started to complain about pain in both his knees and shoulders, while there's no issue with his joints when they did x-rays. Due to skin biopsies, 4 milligrams a day of PSL was prescribed. After further examination and testing, highly pleomorphic filament gram-negative brachy were found. After this was found, the Anopheles sodium sulbacter sodium was prescribed, and Pristinol, or PSL, was described. After the antibiotics had run through the course, he had made a recovery and was able to leave the hospital. How common is thrush? In comparison to RBF, it's much more common than common day, but the people it mainly targets are around the globe. The most affected people are small infants and immune compromised, which is 37% of newborns have thrush in the first few months of their life. Where is thrush most common? Thrush seems to have a large target, not have a large target or big significance in certain parts of the world, but it is very high infectious in infants early in their lives, people over 65, or the immune compromised. This is due to all of these people having people's immune system. It says thrush is a fungal infection that will wait on the tongue in small amounts till it can spread. A baby is a perfect target for it to grow. Example of a case study is when a 35-year-old woman who admitted herself to a hospital because she had been experiencing fever, loss of breath, and cough. She had been prescribed azithromycin, which was 50 milligrams, cotrimoxazole, which is 60 milligrams plus 80 milligrams PO, and paracetamol, 50 milligrams each month. After over a week, she had white bumps encompassing her mouth, severe oral thrush, and itching. The doctors discovered a side effect of the prescriptions she had been given, and helped the thrush in her mouth grow and become extreme. After changing medication and heavy reminding, she was able to make a full recovery. Some extra facts are Staphylobrachial rat bite fever can progress to involve the heart, lungs, and other organs, leading to death in approximately 10% of untreated patients. Oral thrush can be contracted by anyone, but is mainly seen in babies. Has anyone in your family suffered from these infections? What were some ways you can get rat bite fever? And finally, babies are most likely to get thrush. True or false?